Thank you everybody for attending, and thank you to Alejandra for helping us with interpretation support today. Alejandra is a CSU student studying Spanish and Human Development and Family Studies, so appreciate her helping us out today. All right. So to get started, I just want to welcome everyone to part 7 of our 8-part Advancing Healthy Aging webinar series. I would like to let everybody know that this webinar is being recorded in both English and Spanish. And with that said, this series is designed with you in mind to provide valuable insights and tools that can empower you to navigate age-related conversations and support healthy aging within your community. Our team would like to thank the USDA Rural Health and Safety Education Grant, which has made this series possible. We are collecting data and feedback on this series, so at the end of the webinar and in a follow-up email, we will share a link to an optional quick survey in both English and Spanish. Our team very much appreciates your participation in this survey, and your data will be kept confidential and used to inform future programming and other healthy aging initiatives for CSU Extension. Lastly, we will be answering questions at the end of the session. Please add your questions using the Q&A feature at the bottom of your screen. The chat will be closed for participants, so please take a minute to find the Q&A feature at the bottom of your screen. Now let's get started. We are very excited to talk about bridging the digital divide and expanding digital access for older adults. CSU Extension has been building partnerships in this space and has recently been announced as a partner with the Colorado Office of Future Work to support the development of regional digital access coalitions and a digital access planning process beginning this fall. If this is something you're interested in, please make sure to fill out our survey. There will be an opportunity to express your interest, and our team will follow up with you. One of those incredible partnerships we've built has been with AARP OATS, or Older Adult Technology Services. In fact, we have a champion site in Sterling, Colorado at the CSU Northeast Regional Engagement Center, who is utilizing their program to teach everything from basic cell phone and computer skills up to navigating artificial intelligence and how we can use it in everyday life, its risks, and how, with some newfound skills, we can use it to address needs in our lives. With that, I would like to introduce Dayton Romero, a leader in this field. Dayton is the Mountain Central Region Program Manager for AARP's Older Adult Technology Services. With over a decade of leadership and aging services experience, he specializes in developing strategic partnerships and innovative programs that bridge the digital divide and strengthen community resilience. Dayton serves on a number of boards and committees serving older adults and their community, including board chair for Rocky Mountain Healthcare Services, Community Health Partnerships, Colorado Commission on Family Medicine, the Denver Digital Equity Coalition, Age-Friendly Colorado Springs, and more. Welcome, Dayton. We're excited to learn more about your experience in digital access as a super social determinant of health and the exciting programs you have to offer through AARP OATS. Take it away, Dayton.
Thank you so much, Ginger. And just want to say thank you so much to CSU team for the invitation to share a little bit about what we're doing, not only here in Colorado and partnering with you all, but also what we're doing across the country to address the digital divide. And I want to spend a little bit of time of what is the digital divide before going into our organizational history and some of the tactics that we're putting forward to address it. The way that digital inclusion can be defined or looked at is in 3 pillars. One of those is device access. You may notice day to day, you're using your technology to do the various things in your daily life. So it's very important that we address people being able to have the devices necessary to gain access to very critical resources. The second pillar is having affordable broadband or internet access. believe it or not, there are some staggering statistics out there where there are 163 million Americans who cannot access adequate broadband speeds, and further filtering to how that affects seniors. There are 22 million seniors in our country who lack wireless broadband at home. And as Ginger had said, as this relates to the social determinants of health and how we can look at addressing the digital divide as a super social determinant of health, not having access to either two of those things leads to social isolation, limited telehealth access, and reduced disaster preparedness, among many other things. Where OATS fits into this big puzzle is addressing the digital literacy pillar. And so if you walk away today, there are three things I really would like for you to take away from today. That is understanding that it is those three pillars of what digital opportunity and inclusion is. And it takes those three in terms of internet access, having access to affordable hardware, and having access to digital literacy resources. And those three things combined lead to these other opportunities, including access to very critical resources that have effect on your health, as well as just overall ability to thrive. So thank you in joining me today. I will go into OATS history next, and how we first saw that technology was a true barrier. And that started in 2004 with our executive director, Dr. Tom Camber, who alongside a group of volunteers launched OATS in New York City to help seniors learn and use technology to live better in the digital age. Here at Senior Planet and OATS, our mission is to harness technology to change the way we age. And we do that by providing free technology classes for older adults across the country. And so you'll see the various ways we're making our resources as accessible as possible. And that started in 2004. So we launched our Senior Planet Exploration Center in Manhattan, our country's first technology-themed community center for older adults. Fast forward to 2014, where we taught over 10,000 class sessions across 70 partner sites, and empowering and cultivating computer labs to emerge in the New York City region. In 2015, we expanded just outside of New York City, to Plattsburgh, New York. It's a rural community, which really informed how we approach rural communities even today. And we then furthered our expansion in Maryland, Florida, and Connecticut. In 2018, we received some grant funding to expand Senior Planet to Texas and Colorado, which I will really be speaking to our work here in Colorado, as it is one of 10 states that I have the privilege of working, and Colorado is where I call home, and where we have one of 4 Senior Planet centers in the country. In 2020, another grant award came our way, and we launched a program called Aging Connected, which came alongside a national campaign to address that digital divide that I had talked about, with connectivity issues, and really promoting what led to the program called the Affordable Connectivity Program, which looked to basically subsidize internet bills and work alongside internet service providers and policymakers to ensure people have adequate internet access. In 2021, OATS, Older Adult Technology Services, became a charitable affiliate of AARP, leading to our increased reach and impact of partners, people, and overall voice to this very important issue. So I'll focus in on our overall, what we call ethos or our rallying cry. Again, we come from a place of empowerment. And so aging with attitude was truly embraced since 2004 as our rallying cry, our ethos, and our overall approach, which you will see kind of integrates and is woven within our curriculum, our philosophy overall as an organization, and our way of really leading with our participants first and in the center of everything we do. Now, how do we do that? We like to think of our reach and our programs being accessed through 3 channels. And those 3 channels you see on the left is our Senior Planet centers, and we refer to that as our in-person channel. Through our in-person channel, we have Senior Planet centers, brick and mortar spaces, and those technology-themed community centers. We have 4 of them in the country, including in Denver. And it is a space, the photo you see there is actually the one in Denver. And it is an amazing aesthetic space that our participants and our partners can really be proud of coming into. And it is a space where we like to think that builds true community. So not only if you were to visit one of these, would you see some great classes going on and engaged participants, but you would also see folks naturally connecting during one of our social events. You would see folks organically forming book clubs or organically developing partnerships and efforts that they really care about and inform maybe their personal mission. So it is just a space that is thriving and is a hive of activity that we're truly proud of. I'll mention one last thing about our Senior Planet centers that I'm proud of here in Colorado. And that is during the pandemic, we had to close the center, recognizing how big of an impact that had on those that relied on it as a space of connecting and building community and having community. When I started with OATS, I visited the center and it had been closed for 6 months. And I remember literally running my finger on the front desk. There was dust on my finger, calling the internet service provider to get our Wi-Fi back on and our lights turned back on. And all month, that first month where we officially opened, we had 20 people come through. And these were folks who already knew about us. And, you fast forward a couple of years to today, we are so fortunate to see our center back up and thriving since then, where our trajectory has shown that we're approximately serving about 1,000 people coming through our center on a monthly basis. And that number continues to grow, not only because of the quality of our programs, but again, because of community and also just our phenomenal partnerships that we have in the locality of Lowry, as well as with the city of Denver, and as well as with the state. So we just continue to build partnerships and be good neighbors, and that has resulted in people visiting and engaging in our programs in the in-person channel, at least from a Colorado standpoint. The center channel here, where it's referred to as partner sites, is our licensing program. And I'll get into it a little bit further in depth as slides go on, but I highly encourage you all who are in the audience today to go to the website that's mentioned there that says the map. We refer to this channel as our Senior Planet licensing program, and it is our means. It is a free program in which we partner with nonprofits, libraries, senior centers, and other organizations who are looking to address the digital divide in their own community and in their own way. And we're doing that by equipping them with our curriculum to be a capacity builder. So often we see, organizations trying to address a real life problem amongst those that they serve. And that might look like creating their own program, their own tutorial around using an email or creating an email. We have 300 plus programs of curriculum, which I'll also share, that these partners then gain access to and then are able to tailor. So a common phrase we'll use in that channel is we powerfully equip our community partners with the tools they need, not only to increase their capacity, but to address the need of the digital divide that they're seeing among their participants. Next is our UC Online. We refer to this as our virtual channel. And our virtual channel is our most accessible and our means of our widest reach across the country. I always make a joke, and we'll see in later slides, I'm getting ahead of myself. It's very easy to access one of our virtual classes, and we plan them 10 weeks in advance so you could plan your schedule around them. And it's as simple as, I think, 2 to 3 clicks to get and enter even a class. I always make a joke when I do a presentation, when I'm highlighting our virtual classes, that we could jump on our homepage right now and join one very easily. And we will see groups of 500 to 30 that are very engaged and a well-run, quality, structured program where people are learning and growing. Apologies for my glances. I'm working with 3 monitors. So if I do look over here, apologies in advance. This is our landing page that I was talking about. You can see in just a click of a button, as soon as you go to our website, you could see our upcoming online classes, or you could sign up for our newsletter that is highlighting all of our upcoming and newest things that are going on in the organization, or even informative things that can really just shed light on the direction of digital opportunity, where Senior Planet is on that front, and also any local events going on. So when you sign up for our newsletter, there's a way of looking or signing up for, only Colorado, or you could see what the country or what the organization is up to at large in the country. I like to draw attention to our Senior Planet hotline on this slide. It is by far one of my favorite resources that we have at Senior Planet. It is a means of getting questions addressed telephonically, either for yourself if you're a provider and your client, participant, patient, whatever vernacular you use, needs assistance with their phone or navigating their computer. It is such an easy resource to direct toward and for participants to have in their pocket as they proceed to learn or just overall gain access to or answers to their challenges that they're seeing. On the other side of that hotline, people think often when they hear hotline that it is a sort of institutional telemarketer feel. And it's quite the opposite at Senior Planet. Our digital navigators on the other side of the hotline are equipped to answer questions in an empathetic way, and in a very patient way, which I think is just such an amazing touch on that end, especially as families, providers, and participants themselves can be dealing with a very frustrating challenge at that point, looking in all directions. And so I highly suggest either giving that line a call yourself, or really putting it in your back pocket for future use as a supplement to what you're already doing, or as a really good resource for folks in the future. To highlight a little bit of our online offerings and the support we offer through there, we do put our hotline, as you see in that last bullet point, under the umbrella of our virtual offerings. But what I want to highlight in our virtual classes is they're live, happening Monday through Friday, and covering a variety of topics. And we align all of our topics with what we call social impact areas, which I have a dedicated slide to cover those. But just to name a few here in terms of those topics, we have things that like tech basics, stretch and strength, finance, and more. We have virtual discussion groups going on regularly, talking about a various amount of topics, and a great amount of our programs are available in other languages, including Spanish, Mandarin, Vietnamese, Russian, and others. Aside those things, you may notice some of the tabs at the top of our website, and we have articles that are available for folks who just want to read and learn on that front. We have tech tip videos, which is a means of learning asynchronously for those who don't or can't join one of those live classes for their own reasons. And then we also offer one-on-one tech support and coaching. And again, that could be offered over that hotline, or at least scheduled. Further highlighting our virtual classes, these are just some different examples of what you'll find on our website, should you go there. I just going to the morning stretch example here. It is one of our most popular, and not only are folks thriving in a way where they've built community amongst those who regularly join that virtual session, but they're also, addressing those physical needs and following along our, what we like to joke, our instructor's name is Cass, who is Senior Planet famous. He sometimes has, upwards of 500 people joining these sessions and following along. And it's just a really spirited group who's, you can tell, have known each other for a while, or welcoming others who are joining the first time. I tend to be a numbers focused person myself. And so just talking about this slide, I really love the way that it demonstrates our reach. And in 2024, we had over 500,000 engagements across the country. That licensing program, we have over 500 active sites across the country. including 11 here in Colorado across the state. Last year, we provided over 5,400 sessions, program sessions across all of our channels. And to date, our extraordinary curriculum team has created 339 programs available with different topics, different amounts of depth, and all kind of aligning with those social impact areas, as I mentioned. And that number continues to grow, not only from a standpoint of us and our effort partnering and being intentional on reaching those hard to reach folks, but also it's a indicator of the need or demand for this service and resource, and the amount of engagement because of our quality. So being an affiliate of AARP, we continue to collaborate to gain an understanding of what are the barriers, what are the tech trends, and where is this commonly referred to term, where is age tech going? And that often means technology that is created with an intention to serve and accommodate older adults. And that translates into this, this flow chart, essentially, where we're gaining understanding of metrics and research. We're co-designing alongside our partners and older adults who are participants in our programs and using this technology. This ideally transforms or translates into interfaces, for example, that have this design in mind for developers or software. And it kind of goes, so it goes on. To touch a little bit on technology trends among older adults to date, we're seeing wearable health devices as a common technology that's being embraced, as is social connectivity technology. Those are things like video calls and social media, which goes hand in hand with addressing the social isolation challenges that some folks encounter. Others include smart home modifications, as an example. I participated in a conference a couple of years ago, and something that really stood out at the time was this effort, and I don't remember the partners, but it involved a long-term care facility who had many across the country. And what they were testing was those smart home modifications. And they were including in resident rooms in AL's assisted living facilities. They were including technology like the Google Assistant or Alexa, and pairing that with technologies like the thermostat and their phone or their blinds and their light bulbs. And some of the fascinating data that they were showing at the time was how doing that, integrating those types of smart home modifications, led to increased, reduced falls at their facility. And at first, I had a little bit of difficulty connecting those dots. But talking with them afterwards, why they were focused on that indicator specifically was falls was the number one reason people were being admitted to hospitals or having to go to the emergency department. And they found that doing these smart home modifications were a solution because their residents were not having to get up as often to go raise their blinds or turn on their lamp or change the temperature on their thermostat. So it was a very interesting sort of creative way of using this technology to address that. Now, I know on the flip side, an argument is around physical health. We don't want folks to be, stagnant, sitting in their chair more than they should. But I thought it was just a really interesting example of how the smart home modifications are making their way into the older adult space, specifically the long-term care space. So to just share a little bit in terms of our training model, we have what we call labs of excellence, where we have training materials and means of listening to our participants and that informing kind of our training methodology, as well as how we roll out our different programs across the country. And further into our methodology, again, we move forward and create our curriculum with understanding what older adults tell us. We use their feedback, we use their success stories, we bridge that line with surveys in terms of, survey fatigue is real, but we really do it in a way where we're getting quality feedback to drive our approaches and our topics that we're offering in the future. We're also sharing our expertise and our approach across multiple platforms. We're sharing our best practices in a collaborative way and doing that in a way where we're creating reports, and happy to share another link at our OATS.org website, where we've published reports alongside partners like Humana and others to gain an understanding of our impact on a health front and in an academia sense as well. And lastly, just really embracing the qualities of older adults, embracing their curiosity and their motivations and their ambitions, and coming at this again in an empowerment sort of way. Now, I don't expect you to squint your eyes and read all of this tiny print. My intention of sharing this photo or picture, if you will, on this slide is to draw attention to this left side and the impact areas. Those impact areas really inform our program topics. And what I love is, especially with a public health background, is we're not approaching this challenge. We're not approaching addressing the digital divide in a way where we're thinking this, we need to get computers in front of people and we need to teach them computers. We have those foundational classes, as you see in this first gray section, but we approach it in a way where we recognize everyone has a different why. Why are they motivated to engage with technology in the first place? And that then leads to what we call our social impact areas, because we consider ourselves a social impact organization. So again, to draw your attention to this left side, any one of our 300 plus programs will always align with those impact areas. And that includes our foundational area. So in that area, you could find things like computer basics. You can find things like Google Maps. You can find things like Uber and using Google Docs. In our civic participation, you could find ways of how to become virtually active and virtual activism, tips for being news savvy. There's a lot of misinformation out there. So how can we be really intentional online of understanding that? Using govtrack.us, which is a really cool tool to understand where things are at the legislature. Creative expression. This honestly is one of my favorite, where we have so many participants who are really trying to learn and have a curiosity around how do they scrapbook those phenomenal photos of their grandchildren, of their family and friends, or that amazing trip that they just took. And how do I get involved in social media, or how do I edit some of the photos that I took to kind of just get creative overall with it. So we have many programs around those classes or those topics, excuse me. To carry on, so we've covered foundational, civic participation, and creative expression. Our last three areas of impact areas are financial security. I think this is a very important impact area today, where the undertone of many of these programs in this impact area align with navigating things in a safe way. I mentioned that pretty extraordinary number earlier, right? The 22 million seniors who lack wireless broadband to date. There's a big effort going on in our country where that's looking to be addressed infrastructurally as well as inclusionary, getting communities involved. And as folks come online, it's imperative that they are equipped to come into the digital world, equipped and competent and safe in the way that they're, whether they be shopping on Amazon, selling things on Facebook Marketplace, or, job searching. Each of those things need those tools to do so safely. And that spans mainly across all of our programs, but these within the financial security area have a particular focus in on that. I also would point out mobile banking, which I know is a very important piece to date. I always say kind of gone are the days where, we're balancing our written checkbook. There are some out there who still do it, and I am always so impressed when I see it. But we are really moving in a direction where, balancing the checkbook, writing that out, knowing your bank teller and going to the bank, we're almost thrust into this world of efficiency where we're having to use our online mobile banking app to pay bills, transfer monies, and really be fluid within our finances. So we have areas, we have topics and programs around that. Next, moving to health and wellness. Again, we have some great courses on fitness essentials and fitness apps, those wearables, as I mentioned, navigating health, online health resources, telemedicine, becoming oriented with that, as well as MyChart, which personally, I think is a fantastic lecture we offer to really empower and show folks how they can gain access to not only their own health information, but really be informed and have that in their back pocket as they talk with their providers. Next is social engagement. This primarily hones in on what are those social media platforms and how can you get involved in some of those. And one that I really appreciate within this section is really acquainting ourselves with Zoom meetings. That especially has become important as we look to connect with our family across the country or even in other communities, and transportation becomes more expensive or even less accessible for folks. Knowing how to host or even utilize Zoom as a tool to gain access to your loved ones or even involvement in other initiatives or efforts is a really crucial tool for folks to become engaged and involved in their community. So an overview of all of those, and our education team has a great dashboard that kind of breaks down our offerings in a way that says, we have 103 lectures. How many of those very small printed topics were in each of those sections? So that gives you a little bit of a breakdown and showing, we have 14% of our materials in Chinese, and we have 26% of our materials in Spanish. And in terms of our materials by program type, majority of ours is 61% lectures. And we also offer, 10-week courses, 5-week courses, and we also offer live demos, demonstrations of technology, as well as workshops too. We also have some asynchronous content that is available, and that continues to grow as resources continue to make their way. So those are, again, our highlighted impact areas. Photos just speak 1,000 words in of themselves, but what I'll stay on this slide a little bit to draw, again, the attention to the idea of digital inclusion and it being a super social determinant of health. There are many barriers out there, like affordability and reliability. There's complexity around using the devices and the usability of those devices. There's limited skills or even trainings available out there for folks to meet them where they're at. And there's also just the overall privacy and trust in getting online or sharing your data. And I think the important thing as we make the connection between how digital literacy, how having access to internet, and how having the device in your hand makes a difference on your health. And as it relates to social determinants of health, how do we bridge that? How do we understand them? And the way that I like explaining it is digital access and literacy impact every aspect of modern life. It functions as a super social determinant of health. And that cascades, just for a few examples, into things like employment, job searching, remote work, skill development, all very critical, whether it be mobilizing your financial situation or looking for that encore career to feed into purpose and identity. Another, which is a very hot topic right now, is housing. How, without technology, is someone supposed to navigate their, at times, very competitive housing market? I always run two parallels in my mind with that, where we look at, an individual who is driving around looking for those signs outside of apartment buildings or houses of a realtor's phone number and writing that down and calling them. And contrast that situation or that scenario with another individual who not only has already applied to that apartment building, but is looking at 20, 30 more of the same and doing the same. So it's very important, especially as housing inventory becomes a growing problem, not only in our state, but across our country, that people are equipped to downsize, upsize, and move and be mobile as they please, and doing that in a confident way with technology in their hand and navigating that housing market more efficiently. Two others as it relates to social determinants of health, and that includes healthcare. Telehealth is a very interesting area as it relates to this. And I'd looked up some health impacts of digital literacy, and some of the data that was mentioned had shown that low digital literacy causes barriers to healthcare access. It leads to fewer healthcare visits. It leads to less telehealth usage, and it leads to lower satisfaction in overall health. It's very interesting on that front, especially within rural communities, as telehealth is being more and more leaned upon. Lastly, education, having access to education, such as online learning and research and doing digital homework. This not only cascades to or impacts older adults, but it also impacts younger people. So as they look to use education as a mobilizer within their personal missions, it's really important that the education is accessible and it's more and more prevalently being used or accessed online. So some of the attitudinal data that we're looking at here at OATS is four pieces. We're gauging are our participants feel more confident connecting socially online? Are they feeling more equipped to find the resources they need? Are they feeling less alone and more connected? All very important pieces, again, that lead and have consequence on health, especially finding those resources that I just mentioned. Housing, food, transportation, employment, healthcare, all of those things within this simple word of resources have so much health consequence on people. And so it is really encouraging to see that our participants are self-reporting that they're feeling more equipped to find these resources and doing it confidently. And to address the social isolation part of this is feeling less alone and feeling more connected, building that community. Further impact measurements. I have a few sort of examples here in the connected NYCHA. I apologize for the acronym. That stands for the New York City Housing Authority. And we actually have a study, which I think I have a slide on it, in which we really went in with intention to understand our impact with those residents as they participated in our programs. What was their technology adoption and use? Was there heightened engagement? We also really gauge on how satisfied, how are our participants perceiving our programs, and is their experience positive? Do they feel connected? Are they learning? Do they feel engaged? And we currently have a 96 Net Promoter Score, also referred to as NPS quite often, reassuring us that we are on the right track in ensuring that our participants are getting what they would like in our programs. And some of our outcome metrics, again, we're combating social isolation, promoting financial security, and facilitating civic engagement. Excuse me. So this is one of many reports we have available that you can find online, but it certainly is a personal favorite of mine, called Fly Like an Eagle. And we were measuring transformational social outcomes among older adults who are using technology. This was alongside the Humana Foundation, and it specifically worked with low-income older adults. In that report, we found over 50% of trainees reported making a new social contact using technology, more than those who didn't engage in our programs. It's 60% of our trainees reporting that they'd like to try something new, like an event or a social group. So that confidence metric that we just saw kind of actualizing itself through that way. Gains in social connectedness to friends and family during the program were around 20% points higher among trainees than those who didn't participate. And I'm not sure if I have the video in this slide deck, but there is one on our website of Fly Like an Eagle. Where does that title come from? We had a participant give her experience or share her experience during this project, and she said that quote. She said, "I feel like I could fly like an eagle," and it was just a truly powerful anecdote for us to understand the impact that we're making on folks' lives and the overall engagement that it has. Now I'm going to try and play this video, and if it doesn't work, we could do a little bit of a deeper dive into our Senior Planet licensing program, which I'm excited to talk a little bit more into than I already have.
We're only growing, and we realized the best way to reach communities all over America was to license our curriculum and support local entities to deliver our programs in their own neighborhoods.
Senior Planet did a lot of research, and we very much follow their curriculum, which is very nicely paced.
The local licensing partners are bringing magic to this, and we can't do it without them.
Saying to the people's question, the comfort zone is very, very good. My hope is that they're going to use technology to improve their lives.
Aging with attitude and gratitude for not feeling left out from the digital culture.
It's such a cool video. I think what really stands out to me in that is the licensing program being such a powerful train the trainer model for community partners in which they can identify either volunteers or staff that are interested in teaching it. It really is telling that our programs in the licensing program are very turnkey. As a licensed partner, I've heard partners tell us, it really is a capacity builder, because as you become one, you not only gain access to those 300 programs we have available, but you have our support. So you have access to our licensing team who's helping you gain view of what are the most popular topics going on in the country. What are other organizations doing? And I can certainly leave it to our wonderful partners in CSU to give their firsthand experience as being a licensed partner of ours. But what I love is that we offer our partners not only slide decks and talking points for those that align with the slide decks, but also handouts and blurbs and everything that partner needs to be successful in engaging and choosing and tailoring among the folks that they serve. Because what we believe in this is, as a licensed partner, your people best, your community best. And we're simply looking to really be a supporter in that way of how you serve your people. This is a little bit of a newer resource, but it is growing and thriving, where we have an exclusive online platform called Senior Planet Community. It's a social media platform made for older adults and with older adults. And in it, this is a little bit of a kind of a preview into it. There are different groups in there for pet lovers and book lovers. One of my personal favorite is called it's called the Man Cave. We talk sports and all sorts of other things in there. But the unique thing about it is there are no advertisements. There's no pop-ups. There's none of that. It's truly a way to engage and build community and relationships with folks you may not have otherwise connected with, and doing it in a really safe way. A quick ending slide here is how to find us. Those are the three main areas here: is seniorplanet.org. Find our upcoming classes. Again, we operate in a 10-week sort of quarterly period, all of our classes, and those are all posted on the website. So as schedules become busy, we are very aware of that and give people the opportunity to, schedule around and really pick and choose according to how they'd like, and meeting them where they're at. There's our licensing website. There you could find that map. I'd mentioned around 11 to 13 partners here in Colorado. All you have to do is put in your zip code, and you can find the closest licensed partner in your area. And that licensed partner is most likely delivering programs on their own cadence and with their own flavor, which we certainly encourage. And in terms of becoming a licensed partner, there's a very clear, step-by-step, there's 3 steps to becoming a licensed partner and getting your questions answered. And then thirdly, our Senior Planet hotline, which is just an extraordinary resource, and highly suggest you give it a try yourself, or use it as a resource for your own accord personally or for those that you serve. I'll end on a joke with the Senior Planet hotline. I always make a joke that we save families. We've saved family relationships, because I don't know about you or if you've had this situation, but I've become the technology person for my family, and I didn't ask for this. So my grandmother and my uncle and others would call me and say, "Hey, walk me through this. How do I do this?" And rather than, focusing on our relationship of, "Hey, uncle, when are we going to go golf? When are we let's focus on our relationship." And we're always talking about how I could help you with your phone. Our hotline is a perfect resource to do that. So now when my uncle calls me, it's, "Uncle, here's your resource. You got it. Here's the phone number. Call that. Now let's book that tea time." So it's a good sort of relationship reliever when a lot of us find ourselves in that sort of quasi tech person helper for our family. And lastly, just kind of a quick slide here of all of our contact information, socials, etc. But I just want to thank you for your attention and attending and doing what you do. And I'm always happy to connect, or anyone at OATS is always happy to connect. Just an extraordinary team over here, and we're fortunate to do what we do. Thanks.
Awesome. Thank you so much, Dayton. We will go into the Q&A portion next for this. But before we do that, I'm going to put our evaluation survey in the chat for everybody. Let's see if that'll work. There we go. So yeah, it's really quick, 2-3 minutes. When you guys close out of the webinar, it'll pop up. If you want to do it then, great. If you don't have the time and need to move on to your next activity, it'll come in the follow-up email as well. So just appreciate your time in that, and that is really helpful for us developing new programming and improving the services that you guys are receiving today. All right, so we will head into our questions. Let me get into the Q&A. We've got a few going. Let's see, we have our first question. In the assisted living quarters, was it found that the residents were learning to use and trust the smart devices? And has AI developed to better hear what older adults speak, or hear the words that older adults speak? Some older adults can be quiet or have difficulty speaking.
It's a great question. And if I recall correctly to that conversation, I know that there were mixed feelings amongst the different facilities. But those facilities who had what they were calling an ambassador group, kind of those first adopters, if you will, who were residents themselves and being a part of the rollout, really kind of resulted in good success and adoption among other residents. So that's kind of where they saw that. In terms of AI, I haven't really been on the pulse of addressing hearing difficulty or other disabilities on that front. But what I'll say on the AI front, which I didn't mention in my presentation, is OATS has recently partnered with OpenAI and Microsoft. OpenAI is the makers or creators of ChatGPT. And we are really focusing in on creating education on AI and disinformation, what is AI as a tool, and all these other things on it. So I think right now we have about 13 programs specifically on AI, and that is one of our most popular topics right now because it is such an unknown.
Thanks, Dayton. Next question. And I looked this up when this question came through, and I'm very interested in it. Are you connected with or working with an organization called Everyone On for digital equity?
No, not
No.
currently, at least not within my region. I'm not.
Yeah, and I had not heard of Everyone On. I will share the links to this in the chat. So thank you, Sandra Coronado, for sharing that with us. We can send this resource out in our email as well. It looks like it's a website that helps people navigate based on your zip code, access to low-cost internet, as well as free and low-cost equipment. So laptops, digital equipment, whatever you need. So thank you so much, Sandra, for sharing that with us. Okay, next question. Are there any current plans for these programs to spread into some of the underserved areas in the U.S. like Montana, North and South Dakota, Wyoming and Kansas, Oklahoma, Missouri, Arkansas area? We have so many rural adults that would benefit.
I love the question, Sarah. In fact, all of those, aside Oklahoma and Missouri, are in my region. And I've had a really good pulse on each state's plan on addressing the digital opportunity and the digital divide piece. I mentioned the national effort going on. There was a piece of legislation passed about 3 years now, and that resulted in, I want to say, around $65 billion across the country. And that catalyzed states really coming up with their own state-tailored plan that they needed to submit to the feds to gain access to further monies. And I have to say, each state is fairly unique in how they're approaching how they look to address. I'll say in those states particularly, they are moving forward with very intentional efforts of engaging rural communities, particularly building trust on how they offer resources and how they get resources rolled out in those communities. I'll also mention Colorado, which I participated in kind of the crafting of the digital access plan. And in that, we are in the midst of creating coalitions across the state and really empowering those coalitions in rural communities and different parts of Colorado to come together to raise their hand and say, hey, this is what's going on in our community, and this is how we'd like to address it, so that the state and others can get the resources to those states to address those needs. So I'll say in a very general way that I really appreciate how things are coming forward in a tailored way and in a way that appreciates that the communities know what's best for them. And that's what I'm seeing mainly within those rural states. Is that there's a lot of empowerment going on and a lot of listening and trust building.
Well said, Dayton. Thank you so much. And that really relates to the project that CSU is partnering with the state with, and really helping build those coalitions locally and regionally, so folks can, determine what they need best and how we can, get services, education, and whatnot to our communities. Let's see, I think. Okay, yep, Sandra just added again, it's the Everyone On is a national program addressing digital equity, trainings, equipment access, etc. And they focus on rural areas as well as marginalized populations. So, yep, you just put your zip code in, it looks like, on that website, and I added the website. It looks like they have it in Spanish as well, which is amazing. So check that out if you'd like. I'd also like to introduce my colleague, Peggy Stoltenberg. Peggy is with the CSU Northeast Regional Engagement Center, and she is our sort of champion OATS program leader in Colorado, in Sterling, Colorado, and Logan County. And Peggy, if you'd just like to share, your experience working with AARP OATS, what you've gotten it, how your community has received it, and what you've done with it thus far.
Absolutely. So I was just trying to remember during your presentation, Dayton, how I first stumbled upon OATS and Senior Planet. And really, one of the first things I remember is your online exercise courses, and particularly the one that you said was so popular. I was a caretaker for my homebound mother for many years, and we were looking for a way for her just to be able to get some movement. And, it's really hard to sit there and, physical therapy comes in and says, do these exercises 10 times a day. Well, it's just hard to do. So there were a couple different morning exercise classes that I somehow fell upon. And you're right, the one that you talked about is super popular. I would commonly see 500, 600, 700 people in there. And he does have quite a personality and quite a following, but it just worked out so wonderfully for me to be able to just set my computer up for my mom and let her do those exercise classes. And she was still getting that social interaction, even though she was homebound and didn't really talk to people at all. She did get to know some of the folks in those exercise classes. So I think that was probably my first introduction to it. From there, we host a weekly conversation, education, social interaction group called Coffee, Tea, and We once a week on Mondays. And I was the only one coming up with programming for that for quite some time. It's a hybrid program, so we have some folks online and we have some folks in person. And I thought, they have online Senior Planet classes as well. And some of those would fall at 1 o'clock on Mondays, and they worked just perfectly for us. So we kind of went from that progression, like me finding it at home. And then I found the online courses that we showed to our community. And from there, they were just hooked. They wanted more. They had questions. And many of them had the same questions, but many of them were, at different levels, I guess, in their journey of adapting technology. So some of them just wanted to know how to get their cell phone to work. Some of them had maybe used a little bit of Word or Excel in a previous job of theirs and just hadn't really touched it for a while and wanted to be a little bit further along. So we really were able to work with our community. It kind of at one point, we looked for several years, I guess, on trying to figure out how we could do that same type of programming here. And that's when we got introduced to the licensing program. And it's just been fabulous. I've got to say, with any of the programs or curriculums or anything we've done, this is so much by far the easiest, because Senior Planet and OATS are they're fabulous to work with. They're very, like Dayton was saying, they provide the PowerPoints, they provide the handouts, they provide the training for the people who are going to deliver it. It's just like an all-in-one package that is very polished, very easy to understand. It's very easy for a novice or someone who in your community who has never taught something. Or we've had a couple of retired teachers who came in and volunteered and have done just fabulous with the program. So I think that the variety of the difficulty in the programs and just the variety in the topics and programs have been great as well. So we've just had huge success. We did train a couple of older adult volunteers that have really run with some of, I guess, the most basic computer programs. I mean, we had one of your 10-week series here, which kind of started with like turning your computer on. Where's the power button? How do I turn my computer on? Whoa, what's that pops up? How do you get your password in? So we've done everything from that until you mentioned the AI programs. We have had, that has definitely been the most interesting program we've done, the artificial intelligence. So we had our older adult volunteers teach the computer course, but Lakeisha at my office and I are also trained as Senior Planet trainers. And Lakeisha has she did a series for our older adults here at the Engagement Center, very well received. And now our community just can't get enough of that. I don't know how many sororities we've had, how many extension regional meetings, how many people, I've lost count now. Once somebody gets a wind of her presentation about AI, we get like 5 more calls in to see if we can do a presentation for them. So, and it's really cool how that brings together many of our folks definitely have a fear of AI. They have a fear of putting their information out there. They have a fear of what's going to happen. So it's really a good program to, like you said, the disinformation. It's a good program to say, you know what, we understand that this is scary, but it's out there. Here's what it's already doing in your life. If we don't learn about it now, it's gonna be more scary from there. And I feel like that with all of your different programs. So I'll stop talking now in case somebody has questions or wants to know more, but it's been a fabulous experience. I would absolutely encourage anyone who has an interest in this at all to contact us if you want to figure out how to do it through extension. Contact Dayton. It's definitely been a great experience for us.
Thank you so much, Peggy.
Yes.
Awesome. Thank you, Peggy, for sharing. Let's see, let me check the Q&A. I don't see any new questions coming in, but I did put in the chat some information on the Northeast Regional Engagement Center. Again, I will share all of this in an email so you don't have to remember or save all your windows. I know I have probably a million open on my computer right now. So just thank you so much for coming. Let's see, what else do I have on the checklist? Here we go. I just want to say thank you so much to Dayton for today's session. Really thoughtful for older adults and digital equity and access, and making sure that we all have what we need to grow and thrive. I would like to say thank you very much also to Alejandra Aparicio for interpreting for us. Thank you so much for engaging as a student in this work, and hopefully we learned a little bit something new, especially with your human development background. So we'll have to catch up on that soon. Lastly, we have one more thing. Before we sign off, I do want to put a plug in for the Colorado State Unit on Aging and a colleague of mine, Christine Burrows. She's leading a statewide effort for a multi-sector plan on aging. It'll be this draft that I'm going to share with you as the first iteration of a state-led cross-sector 10-year blueprint for improving and developing infrastructure in Colorado to best support older adults. That plan is publicly available, and they are interested in getting feedback from communities across the state, and especially and including our rural areas. So I'll include that in the follow-up information as well. Christine's also interested in holding some listening sessions around the state, and I'll help to be able to facilitate those. So if you're interested, just let me know as well too. And then lastly, I just want to invite everybody to our 8th and final webinar for our series next month, May 15th, same time, 11:30 to 1 Mountain Standard Time. This last webinar will be all about implementing what we've learned and including inclusive programming for older adults with actionable solutions to bring to your community, including ways to ensure people of all backgrounds are able to participate in a meaningful way. So thank you so much. We hope to see you next month, and have a great day.